Hi, I'm Dr. Suzette Glasner, clinical psychologist and associate professor of psychiatry at UCLA. Thank you for joining me today on the Dr. Suzette Glasner podcast. And don't forget to hit subscribe if you'd like to continue to learn from me. Today, we're going to talk about some trends related to cannabis use. These trends are very timely for us to be talking about because we're at a moment where a lot of people are reflecting on their use of alcohol. And this has been prompted by a lot of media attention to the link between alcohol use and cancer, as well as a variety of other health conditions that have just been emergent in scientific research over the past several years. And that, of course, leads them to think, well, what else can I do recreationally? And so, just as an example, one of the trends we've seen anecdotally and written about in the media recently is around cannabis cocktails. So many of you may know that there are two chemical compounds that are found in the marijuana plant. One of them is the addictive substance, which is called THC or tetrahydrocannabinol. And the other is a substance that affects a different part of the nervous system, a chemical compound that is known as CBD or cannabidiol. A cannabis cocktail is sort of the same concept as a mocktail, but rather than trying to sort of mimic the taste and feel of an alcoholic beverage, it's infusing and combining the other typical ingredients of a mocktail with either CBD or THC. And a lot of people are asking the question, like, is this safe and is this okay to use? I'd be more worried about this than alcohol use. Like, what is better? So today we're going to talk about three things. First is, what are the health risks and health related effects of cannabis use that you should be aware of when you're deciding whether or not you want to use cannabis? The second is, how and why does cannabis affect the brain and the body in some of these ways that lead to concerns around health? And then the third question is, how do we know that cannabis is addictive? So let's start with the health impacts of cannabis. What we've learned from a large-scale study that was published very recently is that people with a cannabis use disorder are at an elevated risk of premature death. The second is that an expanding number of studies are now showing that rising cannabis use is linked with increasing rates of schizophrenia. And it's probably related to the way in which the potency of cannabis has been increasing over time as well. Let's talk about the risk of premature death in relation to cannabis use. Researchers recently took a look at individuals who came to a hospital setting, whether it was an emergency room or an inpatient hospital setting, for some reason that was tied to their use of cannabis. They looked at these individuals, compared them to the general population, and they found that among those who needed medical attention in a hospital or an emergency room in relation to a cannabis use disorder, the risk of death within 5 years was nearly triple. And then looking a little bit more deeply at some of the causes of death among these individuals, they found that the risk of death by suicide specifically is nearly 10 times greater among individuals with a cannabis use disorder. And this risk was most apparent in individuals in a certain age bracket between the ages of 25 and 44. So we know that despite the fact that some people find that THC has some very desirable, enjoyable effects, that health risk and complications become more likely with more heavy and frequent use. So here are some of the things that more heavy and frequent use of cannabis can lead to. One of them is progressively more intense and harmful effects on the brain and behavior. For example, some people feel like if they take a little too much cannabis in whatever form they take it in, that can lead them to feel anxious. If you think about anxiety on a spectrum, the most extreme form of anxiety is paranoia and delusion, where you're feeling nervous and suspicious of other people around you. Are they trying to harm me? Are they looking at me in a strange way? Are there certain messages around me that are intended for me? And that's where you can cross into the realm of psychosis. So it really occurs on a continuum, but people who use more heavily and frequently are at elevated risk of crossing over into that severe end of the spectrum where they become paranoid and maybe even delusional. And why this happens is that when you consume large amounts of cannabis, that can release toxic levels of THC into the bloodstream, and that can lead to this very unpleasant and dangerous effect on the brain, such as psychosis. So that's one way in which cannabis use can impact health. A second is that people are using cannabis for some of their perceived therapeutic benefits. So for example, cannabis can be used in order to combat nausea. What can happen when you use it heavily and frequently over time is that some of those beneficial effects can actually be reversed so that your body is responding in the opposite opposite way to what you were trying to get from cannabis was therapeutic. So what I mean by that is that the anti-nausea effect of THC can subside, and then a person can become severely and persistently nauseous, and that can sometimes lead people to hospitalizations, dehydration, and other adverse consequences. Again, there are prescription medications that may have small amounts of THC that can help relieve nausea for people with cancer who are receiving chemotherapy. But for people who start frequently using cannabis products with higher quantities of THC, that can sometimes lead them to excessive vomiting that can require medical attention. So I want to put some of these mortality risks into context. So when I say that people with a cannabis use disorder have nearly triple the likelihood of premature death within 5 years compared to the general population, that premature death risk linked with cannabis use disorder is slightly lower than what you see from alcohol use disorder. But I think that one of the important takeaways from this is that that risk and our understanding of that risk really challenges some of the more widely held beliefs around cannabis use, that it is not harmful, that it is not addictive, and that it's relatively safe for most people, which is really not true. There are a couple of potential reasons that cannabis use disorder could be linked with premature death. We don't fully understand this relationship because this is a very new research finding that is going to warrant some further exploration. But first, we know that cannabis use disorder frequently overlaps with other substance use disorders and mental health issues that impact overall health. We know that there is a very strong mind-body connection, and that people who suffer from psychiatric illness also experience elevated premature death rates. We also know, as I mentioned, that the leading causes of death for those with cannabis use disorder include suicide, with a tenfold increase in the risk of death by suicide in individuals with cannabis use disorder. But there are also a few other health problems that are leading causes of death for those with cannabis use disorders to be aware of. So those are opioid and other drugs, again, strengthening that explanation that it could be tied to overlapping substance use disorders and mental health conditions, trauma, and lung cancer. Some of you may be thinking, was it always this way? Or is there something different about the weed 10, 20, 30 years ago and the weed that's available now? So the weed that's available now has much higher levels of THC than we've ever seen before. In fact, we actually have data on the THC content in seized samples of cannabis. And what those studies have found is that the THC concentration in those seized samples has doubled worldwide and more than quadrupled in the United States, where THC content sold on the streets and in cannabis dispensaries ranges from 25 to 35%, and cannabis concentrate products contain up to 85% THC. And so this is important for our conversation today because we know that marijuana with higher THC concentrations increases those health risks associated with use, including addiction. So other ways that the use of marijuana has evolved is through the increased availability of different ways of ingesting it. We have vaping, and we have edibles have been around for quite a while, but the concentration in edibles that can be purchased in dispensaries is now much higher potentially than ever before. And both of those ways, just those two, can lead to exposure to very high levels of THC and the levels of THC that are known to produce psychosis and other adverse reactions. Also, for people who are new to cannabis use, exposure to very high THC levels can lead to more rapid toxicity and harmful effects. And that probably, at least in part, explains the rise in emergency room visits over recent years in relation to cannabis use. Now I want to talk about this question around the addictive nature of cannabis. And that's really important for you to know because most of the risks that we've spoken about today are really tied to the presence of a cannabis use disorder, which is where a person loses control over their cannabis use in the same way that they can lose control over alcohol or other substance use, leading to signs and symptoms of addictive behavior or a substance use disorder. So here's how we know that cannabis is addictive according to research studies. The first is that people who use cannabis regularly or heavily report similar types of problems to what we see in those who are taking other addictive drugs. When you take an addictive drug and you start to form a dependency on it, it affects your ability to function in various important areas of life. And that's how we diagnose a substance use disorder or an addiction. And we know that cannabis use can have that very same type of impact, rendering people unable to function in important areas of their life, whether that's relationships or at work or school or otherwise. otherwise. And so those symptoms of a substance use disorder really don't depart from what we see with other substance use disorders to other more widely accepted addictive substances such as alcohol and opioids. We also know that between 20 and 30% of people who use cannabis develop a cannabis use disorder, and that people who start using cannabis prior to the age of 18 are especially vulnerable to developing a cannabis use disorder. They're actually 4 to 7 times more likely than adults to have a future diagnosis. So really important to prevent early cannabis use to insulate our young people from developing addictive behaviors and potentially overlapping addictions aside from that to cannabis. We also know that nearly a quarter of those with cannabis use disorder have severe symptoms that lead them to be unable to function in major areas of life, and that there is a very well-studied and documented cannabis withdrawal syndrome, and this affects nearly 50% of people who use cannabis when they try to either cut back or stop completely. So that's the first point. People who use cannabis look very similar to people with other substance use disorders or addictions when they start to develop addictive behaviors. The second is that people who use cannabis enroll into treatment for cannabis use disorders at similar rates to those that are observed for other drugs. And in fact, we're seeing more and more treatment admissions related to cannabis use, which is probably tied to the higher potency of THC that I've described, leading to more adverse and concerning effects earlier on. And then the third is that not only do the symptoms of a cannabis use disorder look similar to that of other substance use disorders, but the patterns of recovery, remission, and relapse to cannabis use after treatment look quite similar to what we see for other substance use disorders. I will say that people find it challenging to achieve total abstinence from cannabis. About 20% of individuals who seek treatment are able to maintain long-term total abstinence from cannabis use, but many more are able to reduce and cut back their use. And the tendency is for people to have more of an interest in cutting back their use than quitting altogether. Part of that is because the symptoms of a cannabis use disorder tend to be less severe than the types of symptoms among people with other types of substance use disorders. So again, there's that perception that like the possibility of using it in smaller quantities or more is something that people are a little bit more interested in exploring in relation to cannabis. But again, those three kind of similarities and parallels with other types of substance use disorders and addictions have led us to conclude overwhelmingly that cannabis is indeed addictive. So if you or someone you love or care about is experiencing symptoms of a cannabis use disorder, if you notice that they seem to be using it a lot or having trouble functioning in important roles in their life, or maybe experiencing adverse reactions to cannabis use but continuing to use it anyway, like they're becoming suspicious or paranoid, or maybe they're becoming depressed or anxious as they're heavily using, know that we do have very effective treatment options for cannabis use disorder, just as we do for other substance use disorders. Most of them are behavioral therapy in nature. We do not have an FDA-approved medication treatment for cannabis use disorder, though there are many candidates that are being currently explored through scientific research. But the first step to help someone with a cannabis use disorder is to get them connected with a healthcare professional or somebody who has some addiction expertise to talk to them about the way that cannabis use is affecting their life and help inform them of some of the treatment options that exist for them. There are great resources like Treatment Atlas through Shatterproof. You can visit their website. There is the SAMHSA treatment locator, SAMHSA treatment locator. You could also talk to your primary care provider if you trust them to get some recommendations for someone with addiction expertise. There's also the American Society of Addiction Medicine that has a listing of individuals who treat addictive disorders. So those are just a few ideas. Definitely worth exploring options to try and help somebody to overcome cannabis use disorder, especially given what we're learning now about the link with early mortality and other health risks. Thanks so much for being here with me today. I hope you learned something valuable, and I will see you next time.